The pianist and composer Rob Kapleau offers vignettes on National Public Radio and longer programs of performance that he calls What Makes It Great. His purpose is to dissect great works of music and explain how the composer constructs the piece to make it great as a whole piece of music. He talks about the way composers can use melodic line and harmonic variation to evoke emotion and sentiment in the listener. He describes how theme and variation can set expectations and then produce surprises. He talks about the way harmonic progressions and tempo and dynamics can increase the tension in a piece and then provide a relief. In Schumann's famous piano work, Traumerei, that little piece that evokes the dream of a child, Kapleau describes how it's only 4 notes that the composer uses repeatedly to build up to different conclusions. And each mini conclusion sets a different aspect of the dreamlike state of the child until finally there's an epiphany in the dream and the piece concludes. In Beethoven's famous Kreutzer Sonata for violin and piano, the violin begins with a set of chords in major mode, and then the piano responds with a set of chords in a minor mode. And this sets up a kind of disagreement between the two that carries on until it reduces to 2 notes, E and F, just a half note apart, symbolizing the entire difference between the two sides of the debate. And these 2 notes also bridge the first part of the piece, which is a slow movement, and the second part, which is the fast component, and lead ultimately to a kind of collaboration that comes to a conclusion. Now, the Kreutzer Sonata is very reminiscent of the process of an IOM consensus committee, because you begin with different views, sometimes opposing. You engage in dialogue. You reach the essence of the difference, and you finally produce a resolution. With Mozart, Kapleau explains that although we may today think of Mozart as having an elegant simplicity, that in his day Mozart was actually baffling to many listeners, because although there was a surface simplicity in his melodic theme, there was often a deep and complex undergirding to that theme. And in a way, Mozart's music, as Kapleau describes, is kind of a hologram with a 2-dimensional surface and a 3-dimensional depth that alternates rapidly before our very eyes, in Mozart's case, before our very ears. Now that's reminiscent of a lot of the charges that we give our committees. Deceptively simple questions like, how much sodium is a healthy amount to consume? And beneath that simple question is a depth of complexity and variation that takes months and a great deal of argument to resolve. Now, there's a lot of commonality, it seems, in history between medicine and music. I'll bet many of you here enjoy music and perhaps play an instrument. Albert Schweitzer was a world-class organist and an expert on J.S. Bach. Larimer and Gwen Mellon, who founded the Schweitzer Hospital in Haiti, both performed on wind instruments and had regular recitals. A very dear friend, Julius Jacobson, a pioneering microsurgery surgeon at Mount Sinai in New York had a patient who was a professional musicologist. And in their dialogue, the musicologist, Arthur Cohn, convinced Jack Jacobson that he should write a book on an introduction to music, which he did and which is now in its second edition. The Longwood Symphony in Boston is made up mainly of medical types performing. So medicine and music have a lot in common, as medicine does often with mathematics. Mathematicians, of course, peak early in their careers. Musicians, blessedly, can demonstrate increasing expression and finesse even into their 9th decades, as illustrated perhaps by Arthur Rubinstein, the late great pianist. Of course, Rubinstein also illustrated the observation from the legendary dancer Fred Astaire, who said, "The higher you go, the more mistakes you are forgiven." Right at the top, they call it your style. So I hope you've enjoyed my style. I want to take a leaf from the book of Rob Kapleau today and reflect with you for a few minutes on the Institute of Medicine, what makes it great. And I think there are many ways to come at such a question, but I'd like to offer 6 dimensions that I think together help make the Institute of Medicine a great institution. First, of course, is the work that we do, its quality, its depth, its scope, its ability to take complexity and convert it to simplicity in a Mozartian mode. Just this past year, for example, the Institute of Medicine released 6 dozen reports and workshop summaries. That's 6 a month on average, although September, I think, set a record for its intensity. And these covered a wide range of topics. They're reported in some depth in the supplement to the annual report that will be available at the break, and I won't really discuss them now, but just think for a moment about this range of topics: falsified and substandard drugs, geographic variation in healthcare, cost and quality, educating the student body, introducing physical activity into schools, U.S. health in international perspective, shorter lives, poorer health, understanding child abuse and neglect, and very recently, the abhorrent problem of commercial sexual exploitation and sex trafficking of children in the United States of America. Evaluation of the PEPFAR program for USAID, evaluation of the California Institute for Regenerative Medicine, evaluation of the Clinical and Translational Science Awards program at the NIH, setting standards of care during crises and when to put them into effect, measuring performance of public health systems and their quality, new ways and models to rank priorities for vaccine development, investment in research, the quality of cancer care in the United States, monitoring HIV in the United States, and priorities for research to reduce the threat of firearm violence directly connected to our program today. This is an extraordinary range, and I think that you too, as you look over what we have done in this last year and the year before, also summarized in Informing the Future, cannot help but be struck by the range and significance of the topics that the Institute of Medicine takes up. What we do, the first ingredient. Secondly, the need for what we do. I believe that the Institute of Medicine and the whole of the National Academies provides a vital national service at a time of increasing need. When you consider the degree of political dysfunction in Washington and you think about the number of pressing, even urgent problems that beset our nation, health to be sure, but also education, climate change, reasonable policy on energy, immigration, productivity, innovation, you go right down the list. Every single one of them depends at their root on scientific understanding, engineering principles, and clear reasoning. Who else is in a better position to provide this kind of objective, disinterested, informed advice than an organization like the Institute of Medicine? So the second ingredient is the intense need for what we do. Third is the quality and the ethos of service that you as members and all of the 3,000 volunteers who serve in one way or another each year for the IOM, you represent. And it's embodied also and expressed in our past leaders who are here in the audience, whom I'd like to recognize. David Hamburg, third president of the Institute of Medicine. David, are you here? I don't see David. Sam Thier, fifth president of the Institute of Medicine. Sam, thank you. And immediately following Sam, Stuart Bondurant. Stuart, are you here? Because as serving as interim president, by the way, Stuart, I'm kind of hoping we don't have to call on you yet again, but you have served exceedingly superbly for us. And, of course, my immediate predecessor, the sixth president of the Institute of Medicine, Kenneth Schein. Ken? Thank you. Fourth on my list of ingredients, after the work we do, the compelling need, and the people, is the environment in which we are privileged to work, embedded within the national academies whose history of contribution, prestige, and collective capacity give us reach on these problems that few, if any, other enterprises can boast in such a directed way to guide policy. Yes, we have some opportunities, I believe, for improvement, such as the governance improvements we talked about yesterday morning. But how fortunate we are over these last 43 years to have had the benefit of the close collaboration and cooperation of our sister academies of sciences and engineering and the whole of the enterprise in which we are based, including these beautiful facilities. Fifth, we have to credit the values expressed and embodied by our founders. If you look at the charter of the Institute of Medicine, for example, a preamble of which was crafted mainly by Adam Yarmolinsky, the namesake of one of our member awards, the second sentence reads as follows: rising expectations of better health and of improved quality of life for all members of our society now include good health care as a universal human right and as a goal of this society. The notion of a right to health, a right to health care, was embedded from the very start in the charter of the Institute of Medicine. Now, if you look at the Constitution of the World Health Organization, it expresses the aspiration as follows, that the enjoyment of the highest attainable standard of health is a fundamental right of every human being. If you go back to the Constitution of the United States, you will find a little different picture. You will find the body of the Constitution, which talks mainly about the powers in each of the three branches of government and the powers that are delegated by the states to the federal government. Finally, in the Bill of Rights, the first 10 amendments of the Constitution expresses those rights which adhere to us as individuals, the right to free speech, the right to the free press, the right of assembly and to petition the government, the right to bear arms, the right to avoid incriminating ourselves, and so on. All of these rights embedded in our Constitution are civil and political rights. There is not one word in the U.S. Constitution about social or economic rights. There's nothing in the Constitution about education, for example. It wasn't until the 20th century that the states of the United States each required primary school education. It wasn't until 1940 that the majority of adolescents in the United States graduated from high school. I needn't dwell on the 19th Amendment, which finally gave women the right to vote, and of course the great and still unfolding civil rights movement in the latter half of the 20th century. But when you look back at the Constitution, you cannot find a guarantee about education, a guarantee about health, a guarantee about old age pensions, a guarantee about work. Nothing like that in our Constitution. And if you look at constitutions around the globe, as Jody Hyman, now dean at the UCLA School of Public Health, did, you find that they vary quite widely in the degree to which they cover a right to health. Before 1970, constitutions adopted in that period, it was only about 30% that covered health. If you look from 1970 to 79, it had leaped to 60% of new constitutions. In the 1980s, it was 75%. In the 1990s, 94%. And after the year 2000, all but one of 33 constitutions adopted in the world included something about a right to health. As Martin Luther King observed, the moral arc of the universe is long, but it bends toward justice. And our founders set the right principles to guide us on a right to health, on science, on the role of evidence, on independence, and on our objectivity. So we owe them a great debt of gratitude. And finally, I think we are great because from the outset, the Institute of Medicine has had a commitment to making a positive difference for health, not content just to sit on the sidelines, not content to stop with good ideas. Our mission, as we express it now, includes the aspiration to improve health. That's our ultimate purpose. And it's so important, I believe, for the Institute to take seriously that expectation and to do everything we can to put in place the programs and the resources that will enable us as an organization to do even more to improve health. One of the things that we are trying to do is to put in place what we call the Impact Fund. The Impact Fund is intended to help the Institute initiate new projects where the need is great, where government may be disinterested or conflicted, where private sources may not be ready yet to support. We're now embarked, for example, on a very critical program of end-of-life care. You all remember the debate in the Affordable Care Act about death panels. Don Berwick, who's here, tried when he was CMS administrator to introduce not the requirement that hospitals should have a conversation with patients about their wishes, but simply to say, by the way, if you have it, we'll pay for it, and even that had to be withdrawn. So it's crucial that we as an organization are prepared and able to take up questions that are of central importance to health, but where government or even private funders may not yet be ready to step forward. We have to do more to motivate those in a position to do more as policymakers, as professionals, as institutional leaders, as members of the public, to protect their health, to advance their health interests, to act on the recommendations of the Institute of Medicine, and for us to do more to convey them in a way that's persuasive, in a way that makes sense to people and meets people where they are. We have to be willing to participate with others, to extend our reach, sensibly, appropriately, to collaborate, to engage with others. And we have to be willing ourselves to stimulate action, as we've started doing in our innovation collaboratives in association with our forums and roundtables. So think about it. Initiate, I. Motivate, M. Participate, P. And act, it all adds up to impact. And that's what we need to do. Now, the Council of the Institute of Medicine has enthusiastically endorsed the idea of putting in place a fund to increase the impact of what we do. With perhaps more questionable judgment, they've elected to name it the Harvey Fineberg Impact Fund. Well, I consented to this because, truthfully, I feel so keenly that this is so important for the Institute. I truly believe that if we can, in this next year, make real progress on the governance reforms that we discussed yesterday, and put in place increased funding and capacity to enhance our impact, we will have done much to make the future of the Institute of Medicine even greater than it is today. Thank you very much. It's now my great pleasure to be able to welcome and to introduce Dr. Victor Zhao and Claire Flanagan, who will take a few minutes to explain and say a few more words about the Impact Fund. Victor is a dear friend, serving as Chancellor for Health Affairs at Duke University and President and CEO of the Duke University Health System. As a member of the IOM Council, he also chairs our Development Committee and has been a real driving force behind the development of the Impact Fund. Victor, welcome and thank you. Claire Flanagan, whom we will hear from also in a moment, is the Director of Development at the Institute of Medicine and has been an extraordinary aid for me and for all of us in bringing the resources we need to the Institute. Victor, the floor is yours.